that therapist is worth it. And you
Hmm.
need to understand that therapist's worth and value, and understand your value and worth. Because if you don't see the value in being able to put some money on your health, something's questionable.
Let's have a conversation about cognitive decline. Let's have a conversation about physical decline. We're educating masses about the brain and the spine. We're educating people about balance, gait, and decline. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation. Let's have a neuro wellness conversation.
Welcome to Neuro Wellness Conversations, where clinical insight meets lived experience. We're two physical therapists having real conversations about neurologic wellness, nervous system health, and what it takes to support both in everyday life. And today we're going to be talking about integrating mental health into physical therapy and talk more about the missing link in recovery.
Oh, yes.
So physical therapy has traditionally focused on the body, as we all know.
Right. Yeah,
But what happens when the body isn't the only thing struggling?
exactly.
What if progress is being limited not by strength or mobility, but by stress, fear, fatigue, or mental overload?
Right. That
That's a
is huge.
that's a big deal, right?
It's a very big deal. And in our scope of practice, it's probably, especially in the neuro side of physical therapy, it's probably one of the most important things we have to deal with.
Mhm.
Um, of course, there's the physical side, but the mental side is huge. And traditionally, it can, in some instances, it was probably not addressed that well from a traditional standpoint.
Mhm.
But from our scope, it is addressed every day we work with a patient.
Absolutely. Literally every day. Because in order for our clients to really have success, they got to want it for themselves.
Right.
I can give you every last thing to do
Yeah.
in the right order, but if you're mentally not into it, you're not
Yeah.
going to see progress.
Exactly. And it's so funny you say that, Doc. I can recall within the past week probably more patients than I can think of that I realized that the treatment needed to shift from what I had prepared to deal with
Mm-hmm.
to dealing with things from more of a mental and psychosocial aspect. I have a patient that I saw recently, and I saw him for a treatment because he was evaluated by one of the other therapists. And for him, his diagnosis was impactful physically,
Mm-hmm.
uh, but not as significantly impactful on the physical side as it was on the mental side. And I literally went in there, no joke, with a treatment already prepared and in my mind, and started to jot down some things we're gonna do, and had to switch the entire treatment
Mm-hmm.
plan because I realized that this gentleman had signs and symptoms of low motivation, complaints of significant fatigue, um, demonstrated some symptoms of anxiety, depression, and I had to really shift my mindset in regard to how I was going to approach our treatment session that day, and kind of focus more on educating him on the
Mm-hmm.
non-motor symptoms of Parkinson's, because he was diagnosed with Parkinson's. And then we had to transition to addressing a lot of these things so that I could educate him, first of all, that these were real things that he was experiencing.
Mhm.
I had him look at and fill out for me the P motor symptom scale. And when he sat down and looked at it, I said, "Do you have any questions or what are your thoughts on it?" He said, "Yeah." He said, "Almost everything on here is describing me."
Mhm.
And I was like, wow. I didn't
Wow.
say wow to him, but
Mhm.
in my mind, I was like, wow, this is real and this needed to be addressed. And it was
Absolutely.
affecting him from a physical standpoint.
And that's why that's a great example, Doc. That's why it's so important as clinicians to build a safe space and a
Yeah.
comfortable environment for our
Right.
clients so that
Yes.
they can operate and feel safe and be able to talk about their psycho-emotional side of things. You know,
Exactly.
there are plenty of times where I had things planned out for clients and it was totally different when they walked in. They weren't having a good day, so the whole
Right.
session I had
Yeah.
completely, and we worked on something completely different. And that's the
Completely
beauty of
different.
what we do,
Yeah.
We have
Exactly.
this knowledge and this toolbox that we can just pull out things and make it
Yeah.
work for the client.
And
That's
that's the
what
value of what we do. And that's why, looking at, and you and I were just discussing about the value of what we offer and how
Mhm.
sometimes there's this feeling of not feeling valued by our clients and our patients, um, because it's all about, okay, as long as my insurance is going to pay for me to come, I'm okay with coming and I'm okay with tapping into your brain and asking you all of these questions that I can't ask my doctor, but they won't take the time to, sit down with me and answer them and have you explain all of this research that I've done on Google, but still yet don't understand. I'm okay with that. But if I had to, financially invest in myself and you for your knowledge and skill set, oh, if the insurance isn't covering it, well, then, find a way to kind of just go around it and Google search it and,
Mhm.
fly in the wind. And
Yeah.
it's frustratingly almost insulting sometimes
Mhm.
when you hear about clients that don't value the therapist enough, that's put in the years, the time, the knowledge, the skills, the training. You just don't feel like that client is worth maybe taking a few, $100, which is what they're asking you to pay for their private sessions, and get that clinician, that therapist, to make you the best you can be.
Mhm.
And honestly, I've had a couple of frustrating days within the past week in that regard, but there are those that are willing to balance it out.
Yes. I'm with you, Doc, on that one. Same sentiment. It can be very frustrating
It
because,
is.
like you said, the education we put in, and we're looking at you as a whole person. We're not just treating you for your Parkinson's or your stroke. We genuinely care about who you are and what goals you want to get back to doing.
Exactly.
To the point
Exactly.
where after your session, we're doing research, we're looking at your MRIs, we're
There
calling your
you go.
other providers to get more information. We're
Great.
putting pieces together when you're not in front of us.
Exactly. Putting in
So
hours sometimes.
yeah.
Hours of after hours, because it
Mhm.
it doesn't just stop when you leave. There's documentation, there's, like you say, researching, there's analyzing MRIs and CT scans and X-ray reports, and trying to get to the bottom of why you are not having the function and the mobility that you want to have and need to have and deserve to have,
Mhm.
um, and trying to figure out how to come up with the best plan for you. I had a patient one time. She was a Parkinson's patient, and she came to my clinic and had gone through the LSVT big program at another local clinic. And when she came to see me, her doctor sent her back for another session of the LSVT program. Now, I didn't know she had gone to another clinic and tried to do the program with another therapist until after our experience of her telling me that after she worked with me the first session, she finally understood, one, how to properly do the exercises, and two, the value of what each exercise was trying to facilitate her to have as far as movement. And so she enlightened me that her therapist at the other clinic actually had another gentleman doing the same exercises at the same hour with her. So he was seeing, this therapist was male. He was seeing two patients, actually three patients at the same time. Two of them were doing LSVT big. The other one was doing something else. He said to the other gentleman that was doing the LSVT big exercise, well, you know those exercises pretty well. You can show Mrs. X, I'll say. And when she told me that, I was I was embarrassed, first of all, as a fellow physical therapist, to hear that this therapist didn't see the value of taking the time to, first of all, help his patient understand what those exercises. Second of all, you're asking a patient to teach another patient exercises that you should be teaching this patient how to do. And so, but after she kind of said to me that what she did with me in the sessions we had together were so beneficial to her, that made me feel a little bit better about the whole scenario. But it just goes to show that when you have a therapist like myself or you, and we pour into you, that's a value that you've got to understand, that you're worth receiving. But that therapist, if they're a cash paying therapist, or if you have to have post therapy services and it requires you to pay cash, that therapist is worth it. And you need to understand that therapist's worth and value, and understand your value and worth. Because if you don't see the value in being able to put some money on your health, something's questionable.
Oh, that's real.
Yeah.
And that brings us to that mind-body disconnect in tradition.
Absolutely.
Body is just treated in isolation. The patient is they're anxious, they're depressed, they have fear, but it's not stress. You're just there to do the exercises. Show Mrs. So-and-so how to do this. And it's like, that's not how it works.
That's not how it works.
That's definitely not how it works. Like we're measuring movement, but we're also missing the environment the movement is happening in, and that's the brain.
Yeah, exactly.
So yeah, that's pretty disheartening to hear about her experience. But I'm glad that you rescue.
Yeah, it was a troubling experience for me. It was eye-opening, needless to say. And it made me realize why I was doing what I was doing as a new clinic owner at the time, fairly new clinic owner at the time. But it made me understand that traditional PT was not where it's at, and needed to do something different. And the neuro approach for me was that difference. Understanding that we, in the neuro world, we don't look at just your symptoms. We look at you from a holistic perspective. We said it on this podcast before, we when you come through the door for that evaluation, we don't just look at your diagnoses and, there's this cookie cutter set of things that we're going to do. We take into consideration your mental health, your sleep, your stress levels. Are you experiencing anxiety? Are you experiencing depression? Your pain, there's so many things that we look at, and
Mhm.
it's so funny. I had a patient today that I saw 2 days ago for an evaluation, initial evaluation, and she said to me, and it made me feel so good. And I told her that, and she said this in front of her spouse. She said, "I went home and I told my husband that was the most thorough evaluation I have
Yeah.
ever been through." And she said, and she, started to explain that she had experienced physical therapy before due to having been in another in an accident. And she was like, "So I understand what, PT is all about." She was like, "But hands down, you were so thorough. It was impressive." So essentially, it did my heart well. It did my heart well to hear you say that.
Yes. Keep up the good work.
Thank you.
Need us in the world.
Absolutely. Because it helps us to realize that sometimes these patients come through the door with stress.
Yeah.
And,
Yeah.
that stress is impactful.
Yes, it is. I mean, the nervous system is the bridge, right?
The bridge.
Stress impacts pain. It impacts how tense your muscles are. It impacts your recovery. You can slow down
Correct.
your recovery from being so stressed out.
Yeah, absolutely.
Your sleep quality,
There you go.
and that keeps that nervous system in that fight or flight mode. So you're never off. You're always on.
On. Yeah. Yeah.
So
Can you
it's
think of any examples, Doc, with any of your patients that you've seen that, you kind of realized that there was some stressful situations coming in and it was
Mhm.
impacting their sessions or their treatment?
Yes. So I had a client come in for essential tremors that he had had for years and was managing well, but
Mhm.
over time things were worse, got
Right.
worse. The neurologist sent him to PT,
Hmm.
and I had the pleasure of doing his evaluation and just getting to know who he was. And he
Right.
was a very calm, cool, collected individual, like
Right.
just an amazing person.
Right.
Unfortunately, he had a wife that was kind of nagging him quite a bit and
Right. Yeah.
stressing him out quite a bit.
Yeah.
And
Yeah.
her expectations for PT was to cure him. And that was never my expectation walking in with him walking in the door. Like I never tell people that I'm gonna cure you and that you're gonna be 100%. I'm here
Correct.
to guide you. I'm here to help you understand how your brain and body work together so
Hmm.
that you can be functional, in the community.
Right.
And he understood it because he was
Hmm.
coming regularly. And I used to take his blood pressure. That was my big thing in the clinic to take the visit because sometimes you get a surprise number. It'd be too high or it's too
Yeah.
low. And I'm
Too
like, okay,
low.
what's going on here? So
Exactly.
one day, I took his blood pressure. It was really low. So I made him lay on the mat for a little while.
Hmm.
And his tremors were just kind of all over the place. And I'm like, what's
Right.
going on? And he kind of
Yeah.
opened up to me about what was happening. And
Ah.
it's disheartening
Yeah.
because I'm trying to treat him and he's understanding the brain body component, but in his home environment, he's not able to cope as well because he doesn't have that support from his significant other.
Right.
So that can be hard. You
Yeah.
know, we have to tackle that in the clinic, but if they can't transfer
Absolutely.
it outside of the clinic,
Yeah.
what's the point, right?
Exactly. Exactly.
Have
Yeah.
the same symptoms.
And I'm almost well, I can't say that it's exclusively in the neuro world, but I'm almost um wanting to know how much of that is looked at in some of the other sides of therapy or aspects of therapy, like, the orthopedic side or the sports medicine side or the, you know, pelvic floor side, because I know it definitely impacts things like pain levels,
Mhm.
um, for sure, especially when you're dealing with chronic pain.
Mhm.
Um, and I'm sure you've seen it as much as I've seen it, where there are those patients that just can't get past that point of improvement
Right.
And when you really delve into things deeply, you
Hmm.
realize that their nervous system is just, like you say, on guard
Yeah.
or
All the time.
all the time.
Yes.
And the stress of their day-to-day life is
Mhm.
really the precursor to it. And I've heard many stories and experienced many instances in which significant others can be contributors to a lot of the stress that a lot of our patients come through the doors with. For
Mhm.
example, I had a patient that came through the door yesterday, and she was supposed to have a treatment session with me, and we had to totally alter things. And I said to her, once I got her on the treatment table, I said I can see the stress in your face.
Mhm.
um, Cheeks were red and flushed, and her tremor, like your patient, was more exaggerated, and
Mhm.
she just looked fatigued. And then she had pain in her back that she didn't typically have
Mm.
um, when she came to see me. And so, my goal at that time was to kind of try to bring her system down.
Mhm.
And like you, I do blood pressure with all of my patients as well, because, like you said, it's an indicator to so much with what's going on with those patients systematically.
Right.
And we need to be making sure that that's something that we're taking, we're addressing, and it helps us to focus and tweak the treatment session the way that we need to so that the patient can benefit from it. So
Right.
for her, a clear example of how stress exaggerated her symptoms, and altered essentially altered the treatment session.
Yeah.
um, we got through it, but I knew she just needed to go home and just kind of put herself in a quiet place, and just kind of
Mhm.
take her a hot shower, and just kind of get her system to just come down tremendously back
Mhm.
to neutral.
Yeah, that's real. Those conversations are had
Yeah.
often, quite
Yep.
often.
And it's
Ask
part of why patients plateau.
that is exactly why patients plateau.
Yep.
That mental fatigue is real. Their brain
Very.
is going a mile a minute. They're
Oh
not
yeah.
concentrating well. They can't think for themselves.
Right. Exactly.
They're not sleeping. There's a lot of people that I've met recently that having insomnia, and then they wonder why they all of a sudden have these seizures. And I'm like, well, your brain is misfiring.
Right.
You're not sleeping. We got to figure out how
Exactly.
to holistically get you to sleep better.
Yep.
You know, um, what else? Low motivation, depression is another
Yeah.
one for
Yeah.
why patients plateau. Uh,
Right.
Cognitive overload. They're just got a lot going on and they can't really
Yes.
focus on therapy. So they're like, yeah,
Right.
why am I paying for this to come here? It's not working for them, you know?
Right. Right.
So, I mean, we can give a perfect exercise program, but if the brain is exhausted,
Yeah.
body's not going to execute anything. That's just
Yes.
what it is.
Yeah. Yeah. And this so completely addresses what neuro wellness is and the benefit of it. Hence why we, named our podcast Neuro Wellness Conversations. I happened to listen into a Zoom yesterday talking about the rise of neuro wellness, and it
Mhm.
pinpointed everything that we're talking about today, apart from the technology side of things that um, is also rising in the neuro world.
Mhm.
um, some of that is some of the technology that you actually work with significantly with the brain tap device. So you can kind of elaborate on some of the things that you note.
Yeah, so BrainTap is a really cool neural technology, and it's a headset that provides light therapy, sound therapy, and meditation all at once.
Yeah.
And it has lights in the ears component of the headset, and there's a visor that you can put on over your eyes, and that helps you calm your nervous system down
Right.
within 20 minutes.
Oh, wow.
Brain fitness for your brain, like exercising your brain, but you're laying down or you're relaxing in a nice chair.
Yeah.
And I've used it on stroke patients and Parkinson's patients at the clinic where they were come in with their nervous
Mhm.
system riled up. And I'm like, you know what? Let's do a brain tap session for 20
Yeah.
minutes,
Yeah.
get calm and relax. And then you do this session with them. So now they're ready to go. They got
Right.
the system calm. They're ready. They're engaged. They can concentrate and they can do the task that I'm asking them to do.
Right.
But it's really great for sleep. I do it myself.
Hmm.
I do a morning session for a kind of a brain boost, and I do a night session to kind of help me power down. And
Okay.
I was just sharing my results on LinkedIn a couple of days ago.
Hmm.
Like my stress level was like 257, which is high.
Yeah. Oh,
And
yeah.
just doing this protocol for like 3 to 4 months, I think it was 5 months I did it, and I'm still doing it, but I just
Hmm.
kind of myself between that time. My stress level was 78.
Oh, wow.
Psycho emotional was way better. It was like from
Right.
8% to 58%.
That's
My
amazing.
nervous system was more, it was more, level. My
Yeah.
stress levels were better. My fight or flight was better.
Hmm.
So it is a really cool tool that's holistic. It doesn't require you to take medication. The only concern I have with it, not really a concern, it's just if someone has seizures, I always like to have the neurologist clear them before they use it. But other than
Right.
it's easy, pop on the headset for 20 minutes,
Yeah.
take a little quick nap.
Yeah.
You're allowing brain fitness. So
Exactly.
it's really
And,
cool.
and my understanding of it is a tool for improving mental wellness
Yes, it
and
is.
comprehensively. And
Yes.
so those people that are looking for improvements in that area, they should definitely reach out to you. I know in my session, I was pleasantly surprised how quickly
Yeah.
I saw changes and improvements in
Yes.
one session. The other
Yeah.
thing was how well it allowed me to kind of de stress
Mhm.
and get into that relaxed state. So
Mhm.
relaxed, I actually dozed off for a
Yeah.
few
Okay.
minutes and didn't even realize it.
Mhm.
But I didn't feel fatigued because, sometimes you can take a short nap and
Mhm.
you wake up still feeling drained and tired
Yeah.
after that brief nap in my treatment session with you. I woke up and I actually felt
Ready
energized,
to go.
ready to
Yeah.
go. Yeah,
Yeah. I always tell my clients, let go of the coffee and do a brain tap. Let
exactly. Yeah,
boost your energy, midday. If you could do a
right,
session a day during your lunch break, minute break and do a brain tap.
right. And this is one of the ways someone can invest in themselves and help improve their, mental wellness and their overall sleep quality and just generally start to feel better. I had a patient who told me today that when he came in, I said, "How do you feel? How did you feel? How are you doing today?" Because I always ask them, that
Mhm.
just out of general concern on how they're doing, how their day is. And he was like, I feel good today. I was like, really? I said, what was the difference? He said, I actually got some sleep last night.
See? Sleep
A-
is
And
the
he typically doesn't sleep well. And so he and I have had this discussion. He's also a Parkinson's patient.
Mhm.
And I was like, that's excellent. I am so glad to hear that because I knew for him mentally, it made such a significant difference because he was so alert, he was so astute, and he was so ready for his
Yeah.
session as opposed to feeling a little fatigued and dragging and, bradykinetic and having his tremor set in and also having more pain
Mhm.
as we were talking about earlier. So yeah, investing in something like Brain Tap and then also the protocol that you have established with Brain Tap is
Mhm.
something that people shouldn't feel that it's a slight in any way to spend that money on themselves. You know, we are in an age where people are looking at all kind of different technology,
Mhm.
and wearables,
Yes.
neurotechnology.
Mm,
You know, there's these bands. A lot of my patients have been asking me about the beach bands, and
mm,
I can say that I've honestly researched them a whole lot to really know um, the specifics on them. There's a lot of other wearables out there that that people can use. But my thing is, if it's helping you to be the better you,
that's it.
listen, do it.
That's it.
If it's not gonna break the bank, because guess what, we can't carry those dollars with us anyway if the good Lord calls us.
That is true. That
So
is so
you know, why not invest in yourself and spend, you know, some money that's gonna help you to be your best self.
absolutely. I love that.
So even though we don't specifically address mental health as therapists, we
Hmm.
do address it because from a psychosocial standpoint, we see a lot of patients that have those kind of psychosocial, psycho-emotional issues, and we
Hmm.
have to know how to tackle it with them in their sessions. But as you mentioned, we also need to think about other resources.
I love referring out to mental health therapists, behavioral health, anything, any provider that I think is going to help my client, I'm going to refer out.
And absolutely. I've done that. I've done that several times as well because I know that that's outside my scope of practice.
Correct.
So I've got names, I've got numbers of, you know, different sources that they can seek and try to get that help that they need.
Absolutely. And I think what we do on top of referring out is we create that safe environment. We adjust treatment based on stress responses, kind of what we talked about earlier as examples,
Right.
and educate on that nervous system and
Yeah.
recovery and how they work together. That's
Yeah.
really the thing.
Yeah. Exactly. Educate, educate, and when you're done educating, educate some more.
That's it.
That's it.
Absolutely. We don't treat the mental health disorders. But we can't ignore
Right.
mental health and physical recovery.
Exactly.
Yeah.
Can't ignore it, especially
Yeah.
as neurotherapists.
Nope.
Yeah. That's what we see so much of every time we work with patients.
Hmm.
And, you know, I love to see when something that I've recommended or a person that I've referred get better.
Yes,
That's why we do what we do.
absolutely. Keep those stories in the back of my mind when I'm having a frustrating day. I'm like, okay, I made a difference in somebody's life today.
Exactly.
So
Exactly.
that's
And
real.
and don't be afraid to, you know, and this is to our listening audience, don't be afraid to let your therapist know how valuable they've been, and know that they are very appreciative and worthy of
Absolutely.
gratitude.
Absolutely. No doubt about it.
Well, it's been a great discussion.
Yes, it has. I have to close with here's my closing line. If we want better outcomes in physical therapy, we have to stop asking only what's wrong with the body and really start asking what's going on in the person. So I want
Right.
the audience to think about that.
Absolutely. I love
And
that. And that's a great way to close it out.
yes, until next time.
Thank you for listening to Neuro Wellness Conversations, where clinical insight meets lived experience. If today's conversation resonated with you, share this episode with someone who could benefit. Be sure to subscribe so you don't miss future conversations on neurologic wellness and nervous system health. Until next time, keep supporting the nervous system that supports you.
Let's have a conversation about cognitive decline. Let's have